The Pharmacy Act introduced a new structure of accountability for the profession of pharmacy, which means that for the first time within a retail pharmacy business, there are newly defined levels of responsibility and accountability, and ultimately the superintendent has the responsibility for patient safety within that practice. Accountability doesn't mean apportioning blame in a negative sense, because this is never constructive and it only leads to situations whereby errors don't get reported and risks don't get addressed, and as a result our systems never improve. What accountability does mean is that you're answerable for what happens in that pharmacy, and full-time accountability means that if something goes wrong, you may still be answerable even if you're not present at the time. But of course, all pharmacists are responsible for their own actions. It's just that now one person, i.e. the superintendent pharmacist, is responsible for defining the overall standards for that practice and for implementing a clearly defined set of procedures which subsequently have to be followed by all the registered pharmacists within that practice.
Superintendent pharmacists are responsible for the overall professional policy and clinical management of their pharmacy practice and within their organisation. Because they must be in personal control at all times, this means they have a full-time responsibility and accountability. Superintendent pharmacists have a particular set of responsibilities. Accountability is simply the process of acknowledging and assuming these responsibilities. If a medication error occurs in a pharmacy, the level of accountability for the error may depend on the nature of the error. To further understand the nature of the responsibility and accountability structure within a pharmacy in relation to errors, it's important to consider the types of error which can occur in practice. Reason's Swiss cheese model is a particular method of illustrating risk-cause analysis and is a useful way for superintendent pharmacists to reflect on error management within their practice. The holes in the Swiss cheese represent the weaknesses within our pharmacy systems or standards of practice, and they vary in size and position. When these individual weaknesses align, an error can occur, resulting in harm to a patient. These holes or weaknesses within our practice can be caused by active failures, which are unsafe acts directly linked to the error itself, such as lack of concentration. Human error is a common factor, and all registered pharmacists as qualified autonomous professionals are responsible in this regard for their own actions. However, in many cases the error can be a result of a weakness in our systems, also referred to as latent failures. These may lie dormant for a long time before finally contributing to an error. Most latent or system failures are preventable, and it is the superintendent pharmacist that is responsible for making sure that safe and consistent systems are in place. If an error occurs due to a system's failure, the superintendent may be asked to demonstrate their personal control of that practice or their processes of risk management within that practice. Let's look at an example. A potential error in practice is the dispensing of an out-of-date medicine to a patient. The patient may take this expired medicine and the consequences may be serious. In such cases, the pharmacist who dispensed the medicine has failed to check the product correctly prior to dispensing and is therefore responsible. However, the superintendent pharmacist is responsible for implementing safe systems and reducing the risk of such an error occurring in the first place. Therefore, they are answerable as to why expired medicinal products were stored alongside legitimate stock in the dispensary. In this particular error, the superintendent has failed in their legal obligation to maintain the required standards of practice as outlined in the PSI guidelines on sourcing, storage and disposal. Let's look at how this could have been prevented. Firstly, the superintendent pharmacist should have identified expired medicines as a real risk within the practice. Secondly, they should have had a procedure in place to ensure expired medicines were removed systematically from the dispensary in line with the PSI's guidelines on the storage of medicines. Thirdly, in their dispensing SOP, they should have also included a requirement for checking dates at the point of dispensing, and all members of the dispensing team, including the other registered pharmacists, should have been trained and signed off on this procedure. Another example of a preventable systems failure would be the sale of a medicinal product without the effective supervision of a registered pharmacist. Again, the superintendent pharmacist may be held accountable, as they are responsible for implementing measures to prevent such incidents. Such measures may include having a policy in place for ensuring a registered pharmacist is present at all times and engaging in effective supervision of the pharmacy. Having policies and procedures such as these in place promotes safe practice regardless of whether the superintendent pharmacist is physically present or not, enabling them to demonstrate full-time control and governance over all pharmacy operations. By clearly defining exactly what is to be carried out, how and by whom, documented procedures also help the superintendent pharmacist to communicate and underpin the responsibilities and accountability of all of their staff. When errors do occur, it is the superintendent pharmacist who must ensure that the cause is identified. All errors should be recorded in the pharmacy and reviewed regularly by the superintendent pharmacist. This is called root cause or risk cause analysis. Findings and observations arising from such a review should then be incorporated into the policies and procedures of the pharmacy in order to prevent recurrence and to safeguard the well-being of patients.